The European health data space kind of is meant as an answer towards the struggling of researchers, especially in the healthcare sector, because we're talking about health data, which is a very sensitive type of data. So there's kind of been a struggle to get the right data sets to perform research. So the European health data space kind of tries to mitigate that struggle that researchers, especially in the health sector, have found. So we will be able as researchers to have better access to health data in particular. And we have the data, but it's not being shared efficiently. So that's where the European health data space for secondary use tries to provide an answer and see how researchers can access certain anonymized data sets, preferably better and easier, in order to promote research, in order to stimulate innovation. Apart from the entire data aspects of the Hereditary project, of course, also a new kid on the block is the AI Act that is now slowly turning into force or being applied. So that's also something that we're looking at. How does the AI Act impact the use of AI models in the Hereditary project, especially for research purposes? So we kind of start out with mapping everything that is there, and there's a lot. There's really been a boom in legislation. So we start with really looking at what's already there, and then of course what's applicable to the Hereditary project in itself. After having mapped what we kind of want to look at, we then go in depth, see what obligations are applicable to the partners, what really needs to happen to the data, how do we need to present our output to also be the most relevant of a project as we can be, of course. And then also by talking with the partners and seeing what they're doing, how exactly in practice they are working and how the data streams, for example, occur, we take that into account and see that our feedback and output is as personalized as possible to the Hereditary project.